Okay, good afternoon, and thank you for joining the daily briefing on the City of Philadelphia's response to COVID-19. Today, our speakers are again joining us virtually to adhere to social distancing guidelines. We urge all of the reporters who have logged in to make sure that their login name indicates their full name and media affiliation. We'll begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thanks, Mike, and good afternoon, everyone. I really know it's been a long few months for all of us, but today I'm happy to share that if our current rates of progress continues, it is likely that Philadelphia will reach the green phase in early July. As we've said before, Philadelphia will allow green phase activities to restart when it achieves certain targets that measure progress against the COVID epidemic. So while we're anticipating that this will happen as early as July 3rd, I want to remind everyone that our actions each day will determine whether we are indeed able to take that next step. And I'm going to reemphasize that. Our own actions will determine whether or not we continue to move forward or not. And as you've seen in other areas of the country, that irresponsibility has set them back. So let's not go there. The metrics we're monitoring were presented in the Safer at Home plan. The green phase plan, which we're calling Reopening with Care, lays out specific targets that measure progress in reducing the presence of the virus in Philadelphia. This includes the reproductive rate of the virus, adherence to guidance on mask use, the effectiveness of containment activities, the capacity of the healthcare system to manage additional cases, and the effectiveness of efforts to protect vulnerable populations. In addition to preparing for the green phase, we will also allow certain activities that are not high risk and are allowed in the governor's yellow phase plan to restart earlier on June 26th. This will include residential swimming pools and private swim clubs, zoos, outside portions only, small indoor gatherings, and personal services such as salons, barbers, and spas. Declaring Philadelphia in the green phase does mean that not all activities can restart. In the green phase, Philadelphia will still prohibit or restrict some activities that are allowed by the Commonwealth of Pennsylvania. For example, restaurants will be allowed to open with occupancy limits, but casinos and indoor theaters will not. These higher risk activities, casinos, indoor theaters, conventions, and large indoor religious gatherings are not allowed in Philadelphia's green phase and will be allowed to restart subsequently. They will be opened on different dates based on the risk presented by each activity and the situation with the epidemic. Dr. Farley will be with us in a moment to explain further about this important step. And before I switch over to another topic, I want to briefly recognize Shalimar Thomas and the North Broad Renaissance for giving us the inspiration behind the naming of our green phase plan, Reopening with Care. The team at North Broad Renaissance launched a campaign to help businesses on their car to reopen safely when the stay-at-home order was lifted, with the goal of not only supporting businesses, but also restoring consumer confidence by letting people know that businesses are following recommended safety procedures to keep customers safe. Their Reopen with Care campaign has been going strong on North Broad. And as we prepare to enter the green phase, the city is proud to join Shalimar and her team in taking this campaign citywide. It is critical that as more businesses and activities resume, they take the necessary steps to keep employees and customers safe and healthy. Our Commerce Department will be working with North Broad Renaissance to bring more commercial corridors throughout the city on board, getting them to sign a pledge committing to follow our health department's safety guidelines and supporting them with other needs associated with reopening. I also want to thank all of our business organizations, including the African American Chamber, the Hispanic Chamber, the Asian Chamber, and the Greater Philadelphia Chamber of Commerce, and more about helping us get critical information about each phase of reopening out to our businesses. Now I'll turn briefly to another topic. I know folks are waiting to hear about the budget. As you know, City Council's Committee of the Whole last night gave preliminary approval to a new budget and capital program. I want to thank all the members of council. With the leadership of Council President Darrell Clark, they stepped up as true partners throughout the most difficult budget process I have ever experienced. They approached this work with a level of seriousness and dedication that matches the gravity of the situation facing Philadelphia, both in terms of COVID-19 pandemic and our shared desire to work towards social justice and racial equity. I also want to thank Finance Director Rob DeBoe and Budget Director Marissa Waxman and their staffs. They have worked tirelessly over the past few months to ensure that the city is fully prepared and doing the right thing as the economy went into a tailspin. Rob and Marissa have joined us on this call if you have specific budget questions. It's extremely disappointing that at this time we are not able to move forward with some of the crucial investments we proposed back in March, before the pandemic and resulting economic downturn were felt in Philadelphia. It pains me that this budget reduces some city services and eliminates hundreds of jobs. Still, we have prioritized core services, protected our most vulnerable residents, and maintained our financial flexibility to enable a quick rebound. In short, I believe this budget will accomplish the goal I laid out on May 1st. We will keep all Philadelphians safe, healthy, and educated while maintaining core municipal services that our residents rely on daily. Just as importantly, the most difficult decisions were made through a lens of racial equity. The budget intentionally limits the impact of service delays or cuts on people of color, who are disproportionately impacted by the virus and already suffering from decades of systemic inequality. I look forward to the final approval of the budget by City Council on June 25th. And now Dr. Farley will have details on COVID-19 and Philadelphia's move to the green phase. Thank you.
Thank you very much, Mayor. I'm going to talk more than usual today about the future of the COVID epidemic here in Philadelphia. First, though, some basic numbers. Since this time yesterday, we've identified 68 new cases of the coronavirus infection, bringing us to a total of 24,723 since the beginning of the epidemic. And that's with nearly 2,400 test results since yesterday. In our hospitals, we have 238 patients in Philadelphia and 449 patients in Southeast Pennsylvania. That's a continued decline for weeks now. Since this time yesterday, we've identified 10 new people who died from the coronavirus infection, bringing us to a total of 1,513, of which 775, or 51%, are nursing home residents. Now, more important than the individual numbers, though, is the long-term trend. We were seeing nearly 600 cases a day in mid-April. Now we're down to about 80 cases a day on average. And in mid-April, about 40% of the people tested for the coronavirus infection were positive. Now we're down to about 3%. That overall is a huge success. And it's a result of people following the stay-at-home order. The people of Philadelphia didn't just flatten the curve, you suppressed the virus, and in the process saved thousands of lives. So I want to congratulate the wonderful people of Philadelphia for doing the right thing and beating back this epidemic. Now that success, though, has come at a price. I know it's been very difficult for people. For some people, it's just that they're bored and stir crazy being stuck at home. But other people have lost their jobs and people have lost their businesses. Many people are truly suffering and some are actually hungry. So what do we do now? Well, we're approaching the time for us to carefully reopen and restart. Get people back to work, get people money so that they can buy food and pay the rent. Now, the key word here is carefully, because we have examples from around the country of what happens if we reopen without care. There are now more than 20 states across the United States where coronavirus case rates are rising. In several states, like Arizona and North Carolina, case rates are higher than they've ever been. Other states, like Florida, had an initial peak, then a fall in case rates. They reopened, and they've seen a second wave. In Florida, that second wave is more than twice as high as the first wave. The second wave took about 4 to 6 weeks to occur after they reopened. So to help everyone recover from our response, we have to reopen, but we don't want to be another Florida. So today we're releasing our plan for green called Reopening with Care. Looks like this. It's our strategy for green. The plan includes targets for what we need to achieve in order to reopen in green. It defines what activities are allowed in green in Philadelphia and what is not allowed in green in Philadelphia. As the mayor said, what will be allowed in Philadelphia is different from what has been allowed and will be allowed in the rest of Pennsylvania. It gives estimates for the dates for implementation of these. So just a sense of those targets. I have a target for the number of cases being less than 80 per day, or fewer than 4% of people tested being positive. A target for a trend in the number of cases per day falling for 4 weeks after we went to the yellow phase, so that we're certain we're not having a second wave begin. As targets for containment, such as testing more than 2,000 people per day, and for contact tracing. As targets for our healthcare system capacity to be more than 75% below the peak, so that we know we have plenty of available hospital beds should we have more cases. As targets for how many cases are occurring in nursing homes, less than 5 per week. Now, many of these targets we have met already or are likely to meet soon, so we're very close. But one key one is going to prevent us from moving to green, and that is we want to see continued decrease in cases in daily case counts for 4 weeks after we go to yellow. That's time to assess whether, like Florida, we might have moved too fast or too carelessly. So the earliest date we could go to green would be on Friday, July 3rd. But I am optimistic that we will meet the targets and be able to open to green at that point. Now, if the state of Pennsylvania gives approval, we will allow some of the currently prohibited activities to start before then on June 26th, as the mayor mentioned. And that would include residential swimming pools and private swim clubs, the zoo, the outdoor areas only, personal services such as salons and barbershops, and small indoor social and religious gatherings of up to 25 people. So here's what would be allowed in green in Philadelphia when we do go to green. Outdoor group recreational and sports activities for youth and adults beyond those which are already allowed. Indoor shopping malls, libraries and museums, gyms, schools, colleges, outdoor small events, and restaurants with indoor seating with restrictions on occupancy. Now, this is important. Many people seem to think that green means go. Green, therefore, means everything is allowed. Green does not mean that every activity is allowed. And green in Philadelphia will be more restrictive than green in the rest of Pennsylvania, both in what activities are allowed and how they must take place. Each activity will come with very specific guidance, our safe mode guidance, and a safety checklist. We'll go through these 8 items: masks, barriers, like those clear plexiglass things you see at cash registers, distancing, keeping people 6 feet away, reducing crowds, isolating people who may have symptoms, hand washing, cleaning, and communicating the rules to everyone. Guidance for all these activities will be posted on our website next week. Now, there are higher risk activities that will not start when Philadelphia reaches green, such as large outdoor events, theaters and indoor events, casinos, in-person conferences and conventions, large indoor social and religious gatherings, and senior services involving gatherings such as adult daycares. Each of those poses greater risk because of the number of people involved, their proximity, or their inability to follow other safety measures. Each of those will be allowed to restart on different dates based on the individual risk of that activity and based on the trends in the epidemic and the trends in our control metrics. So what will happen in the health department after green starts? Well, we're going to continue our overall plan. It has 3 elements of it: containment, which is testing, contact tracing, isolation and quarantine, protecting vulnerable populations, and then the social distancing measures. We're going to continue to promote our safe mode guidelines with businesses and with organizations. And for individual residents, remember those 3 things: masks, distance, hand washing. And we're going to be watching our numbers very closely. We're going to follow the metrics that we laid out in our plan, and we're going to follow our 2 early warning signs. Now, this is important. If we see signs of increased viral spread, we may have to close activities again. We may even have to go back to yellow. The other states' experience says that this is a very real risk, so I want people to be prepared for that right now if that were to happen. We do not want it to happen, but if we do, we need to be able to act to protect people. For today, though, what we're talking about is really very good news. Businesses and people can start to plan their reopening activities. Soon, many of these activities will restart. But I just ask that when people plan when they restart their activities, they should also plan how they're going to do them in a safe way. Follow our safe mode guidelines and all of our safety checklists. That's how we truly reopen with care. Thanks a lot. Now I'll turn it over to Armando.
Mensaje del alcalde Jim Kenney para el 18 de junio del 2020. Buenas tardes a todos. Sé que han sido unos meses largos para todos nosotros, pero hoy me alegra compartir que si nuestro ritmo actual de progreso continúa, es probable que Filadelfia pase a la fase verde a principios de julio. Como hemos dicho antes, la ciudad permitirá que las actividades de la fase verde se reinicien cuando se logren ciertos objetivos que representan un avance en contra de la epidemia del COVID-19. Nosotros anticipamos que esto sucederá el próximo 3 de julio, pero quiero recordarles a todos que dependerá de nuestras acciones diarias el que podamos dar el próximo paso. Las cifras que estamos monitoreando se presentaron en el plan Más Seguro en Casa, como llamamos a la fase amarilla. El plan de la fase verde lo llamaremos Reapertura con Cautela. Este plan establece objetivos específicos que miden el avance en la reducción de la presencia del virus en Filadelfia. Esto incluye la tasa de reproducción del virus, el cumplimiento de las directrices sobre el uso de las máscaras, la efectividad de las actividades de contención, la capacidad del sistema de atención médica para manejar casos adicionales y la efectividad de los esfuerzos para proteger a las poblaciones vulnerables. Además de prepararnos para la fase verde, también permitiremos que ciertas actividades que no sean de alto riesgo y que estén permitidas en el plan de la fase amarilla del gobernador se reinicien antes, es decir, el 26 de junio. Esto incluirá las piscinas residenciales y los clubes de natación privados, los zoológicos, solamente en sus atracciones externas, los salones de belleza, las barberías y los spas. También se permitirá pequeñas reuniones de personas en espacios bajo techo. Quiero ser enfático y que quede claro que Filadelfia pase a la fase verde no significa que todas las actividades van a poder reiniciarse. En la fase verde, Filadelfia seguirá prohibiendo o restringiendo algunas actividades que sí son permitidas por la Mancomunidad de Pensilvania. Por ejemplo, los restaurantes podrán abrir con límites de ocupación, pero los casinos y los teatros en espacios cerrados no. Estas actividades de mayor riesgo, es decir, casinos y teatros en espacios cerrados, convenciones y grandes celebraciones religiosas, no están permitidas en la fase verde en Filadelfia y se les permitirá reiniciar posteriormente. Se abrirán en diferentes fechas en función del riesgo que represente cada actividad y la situación en cuanto a la contención de la pandemia. Y antes de pasar a otro tema, quiero reconocer brevemente a Shalimar Thomas y al North Broad Renaissance por inspirarnos en la designación de nuestro plan de la fase verde, que se va a llamar Reapertura con Cautela. El equipo de North Broad Renaissance lanzó una campaña para ayudar a las empresas en su corredor comercial a reabrir de manera segura cuando se levantó la orden de permanencia en el hogar, con el objetivo de apoyar a las empresas y también de restaurar la confianza de los consumidores, informándole a la gente que las empresas están siguiendo los procedimientos de seguridad recomendados para mantener seguros a sus clientes. Es fundamental que a medida que se reanuden más actividades, se tomen las medidas necesarias para mantener a los trabajadores y a los clientes seguros y saludables. Nuestro Departamento de Comercio trabajará con Northport Renaissance para incorporar más corredores comerciales en toda la ciudad, haciendo que se comprometan a cumplir con las directrices de seguridad de nuestro Departamento de Salud y apoyándolos con otras necesidades asociadas con su reapertura. Ahora pasaré brevemente a otro tema que sé que la gente está esperando escuchar. Como saben, el Comité Plenario del Consejo Municipal dio anoche su aprobación preliminar a un nuevo programa de presupuesto. Quiero agradecerles a todos los miembros del Consejo. Bajo el liderazgo del presidente del Consejo, Darrell L. Clark, ellos se convirtieron en verdaderos aliados en el progreso del proceso presupuestario más difícil que jamás haya tenido nuestra ciudad. Abordaron este trabajo con un nivel de seriedad y dedicación que coincide con la gravedad de la situación que enfrenta Filadelfia, tanto en términos de la pandemia del COVID-19 como con nuestro deseo compartido de trabajar por la justicia social y la equidad racial. También quiero agradecerle al director de finanzas, Rob Dubow, y a la directora de presupuesto, Marisa Waxman, y a todo su personal. Ellos han estado trabajando incansablemente en los últimos meses para que la ciudad esté completamente preparada y haciendo lo correcto a medida que la economía se desploma. Rob y Marisa están con nosotros el día de hoy si tienen preguntas específicas sobre el presupuesto. Es extremadamente decepcionante que en este momento no podamos avanzar con algunas de las inversiones cruciales que se propusieron en marzo antes de que la pandemia y sus consecuencias económicas se empezaran a sentir en la ciudad. Y me duele que este presupuesto reduzca algunos servicios de la ciudad y elimine cientos de empleos. Aún así, hemos priorizado los servicios básicos, protegiendo a nuestros residentes más vulnerables y manteniendo nuestra flexibilidad financiera para permitir una pronta recuperación. En resumen, creo que este presupuesto cumplirá la meta que anunciamos el 1 de mayo. Mantendremos a todos los habitantes de Filadelfia seguros, saludables, con educación, mientras conservamos los servicios municipales centrales en los que nuestros residentes confían diariamente. Igualmente importante, las decisiones más difíciles se tomaron con una visión de equidad racial. El presupuesto limita intencionalmente el impacto de los retrasos o recortes de servicios en las comunidades de color que se ven desproporcionalmente afectadas por el virus y que ya sufren décadas de desigualdad sistémica. Espero la aprobación final del Consejo Municipal el próximo 25 de junio. Y esta es la actualización en materia de salud para el jueves 18 de junio del 2020. Buenas tardes. En general, hoy traigo buenas noticias. Vamos a dar nuestras actualizaciones de costumbre y luego hablar del paso a la fase verde. Vemos un avance sostenido. Desde ayer se han confirmado 68 nuevos casos de coronavirus en Filadelfia y actualmente tenemos un total de 24.723 casos en la ciudad. 238 personas están actualmente hospitalizadas por la COVID-19 en Filadelfia y 449 personas en la región sureste de Pensilvania, incluyendo el condado de Filadelfia. Pero lamentablemente también tenemos que reportar 10 fallecimientos por la COVID-19 en la ciudad. Hay un total de 1.513 personas que han muerto por la COVID-19. Y ahora quiero hablarles sobre las tendencias más importantes. A mediados de abril estábamos reportando 600 casos diarios aproximadamente. Hoy estamos reportando menos de 80. 40% de los resultados que recibíamos a mediados de abril eran positivos. Ahora solo lo son el 4%. Este éxito es el resultado de que nuestros residentes han acatado las órdenes de permanencia en casa. Y sabemos que esto ha sido muy difícil. Muchas personas han perdido sus trabajos o sus negocios. Muchas personas han experimentado inseguridad alimentaria y muchas han tenido serios problemas con esto. Y hay otras personas que simplemente se aburren de estar en el mismo lugar, encerrados todo el tiempo. Pero a pesar de todos estos grandes sacrificios, la estrategia de la ciudad ha funcionado. En Filadelfia no solamente hemos aplanado la curva de contagios, sino que hemos suprimido el virus. Siguiendo las indicaciones, hemos contribuido a salvar muchas vidas. Felicidades a nuestros maravillosos residentes por hacer lo correcto y por hacer retroceder esta pandemia. Y ahora ustedes se preguntarán, ¿cuáles son los próximos pasos? Bueno, nos acercamos al momento de abrir con cautela y reiniciar la actividad económica. Las personas deben de volver a sus trabajos porque necesitan sus ingresos para cubrir sus necesidades básicas. Pero tenemos que tener en mente una palabra clave, la cautela. Porque puedo darles algunos ejemplos de lo que pasaría si no abrimos con cautela. En 20 estados, los contagios por la COVID-19 aumentaron, como en Arizona y Carolina del Norte. En otros estados, como en la Florida, se procedió a la reapertura, pero una segunda ola de casos apareció entre 4 a 6 semanas después. Para ayudar a la recuperación, tenemos que reabrir, pero no queremos convertirnos en otra Florida. Y hoy estamos anunciando el plan para el paso a la fase verde. Reapertura con cautela. ¿Qué es lo que incluye este plan? Objetivos que necesitamos cumplir para reabrir en verde. Definir qué actividades están permitidas en la fase verde en Filadelfia. Definir qué actividades no se permitirán en la fase verde en Filadelfia, las cuales pueden ser diferentes de lo que está sucediendo en el resto del estado de Pensilvania. Y otorgar fechas estimadas. Y estos son nuestros objetivos para lograrlo. Que el número de casos menores a 80 casos diarios o el 4% de todas las pruebas que se reciban. En cuanto a contención, el administrar más de 2.000 pruebas diarias y el empezar a mantener un rastreo de contactos. Mantener la capacidad del sistema hospitalario menor al 75% de su capacidad total y que los casos en los hogares de ancianos sean menos de 5 casos semanalmente. Muchos de estos objetivos ya los hemos alcanzado o los haremos alcanzar muy pronto. Estamos ya muy cerca. Un aspecto clave es la disminución del total de los casos 4 semanas antes de pasar de una fase a la otra. Es tiempo para evaluar si Florida se movió demasiado rápido o si lo hizo descuidadamente. En Filadelfia, la fecha más cercana para cambiar de fase es el día 3 de julio del 2020. Ni un día menos. Estamos optimistas en alcanzar nuestros objetivos para esa fecha. Si el estado de Pensilvania nos da su aprobación, vamos a permitir algunas actividades que estaban prohibidas antes. Algunas de las actividades que se permitirán en la fase amarilla en Pensilvania son los deportes grupales al aire libre, las piscinas, el servicio de cuidado personal, los salones de belleza y las barberías, las pequeñas reuniones sociales y religiosas donde haya menos de 25 personas. Y las actividades que se permitirán en la fase verde en Filadelfia a partir del 3 de julio incluyen la apertura de centros comerciales bajo techo, la apertura de bibliotecas, museos e instituciones culturales, los gimnasios, las escuelas y las universidades, y pequeños eventos al aire libre. Los servicios en restaurantes y bares funcionarán con restricción en cuanto al número de personas que se permitan ingresar. Es muy importante destacar que estar en verde no significa que todas las actividades estén permitidas. Y la fase verde en Filadelfia será más restrictiva que en el resto del estado, en el sentido de que hay actividades que están permitidas bajo ciertas órdenes. Cada actividad tendrá una directriz específica, con un listado de verificación de normas de seguridad, que incluyen, por ejemplo, el uso de máscaras, las barreras de seguridad de plexiglas, la distancia social, la reducción de multitudes, el aislamiento cuando sea necesario, el lavado de manos frecuentes, la limpieza y la comunicación clara con los clientes y el personal de las instituciones. Todas estas directrices se publicarán en nuestra página web la próxima semana. Las actividades de alto riesgo que no comenzarán en Filadelfia cuando pasemos a la fase verde son grandes eventos al aire libre, los cines, teatros y eventos bajo techo, los casinos, las conferencias con gran número de personas, las grandes reuniones sociales y religiosas y las actividades para adultos mayores que involucren multitudes. Estas actividades se realizarán en fechas diferentes basado en los riesgos y las tendencias que veamos. ¿Qué pasará después de que la fase verde comience? Seguiremos con el plan, la contención del virus y continuaremos protegiendo a los más vulnerables. La distancia social es algo clave. Seguiremos promoviendo el modo seguro para que funcionen los negocios y las organizaciones. Y para los residentes, recordarles continuamente el uso de las máscaras, el respetar la distancia social y el lavado de manos frecuente. Vamos a estar monitoreando las cifras de cerca y vamos a ver si hay señales de alarma temprana. Si fuéramos a ver señales de un repunte del virus, tendremos que parar la fase de reapertura y tal vez retroceder nuevamente hacia la fase amarilla. La experiencia de otros estados nos indica que este es un riesgo que aún está presente. Pero hoy nos enfocaremos en las buenas noticias. Los negocios y las personas pueden planificar reiniciar sus actividades con la nueva normalidad. Les pedimos a todos nuestros residentes que no planeen solamente cuándo, sino cómo seguir en un modo seguro el reinicio de sus actividades, es decir, cómo reabrir con cautela. Estamos muy cerca y solo con su ayuda podremos lograrlo. Muchísimas gracias.
Thank you, Armando. And we are now going to move to the Q&A portion for members of the media. As the mayor noted earlier, we are joined today by Finance Director Rob Duba and Budget Director Marissa Waxman for any questions related to the budget that you may have. And of course, we are joined as well by Managing Director Brian Abernathy. Please limit your questions to topics related to the COVID-19 pandemic. If time permits, we will open the floor later to other topics. So if your hand is now raised for another topic, please lower it. We'll try to get to you later. Remember, we have limited time during the briefings. Only one representative from each media outlet is permitted, at least for the first round. And please limit your questions to 3 or fewer. For now, let's get started with Jeff Cole of Fox 29. Hold on one second, Jeff. All right. I am having trouble unmuting you, Jeff. Are you able to do that yourself?
There I go. How's that?
Yep, you're good.
Dr. Farley, for you, it would appear under this plan that the counties in southeastern Pennsylvania may go, if Governor Wolf makes the call tomorrow, to a full green next Friday on the 26th at a time when Philadelphia will be in a still a bit more restrictive. Have you calculated that? Do you think that's a possibility? And how does that play in your plans here?
I would say that that's very likely. And so, that makes sense to me. Philadelphia is unique. We are the county that's had the highest case counts, highest case rates, largest population, greatest population density. We have a very high poverty rate. We've had protesters in the last few weeks. So we need to be more careful than other counties around us might be able to get away with.
Does it mean that because people could obviously move back and forth from the counties, does it alter the numbers or how you look at community spread or how you make decisions as to when and whether we go to green on the 3rd?
We're going to be looking at just the numbers for the city of Philadelphia and our metrics to see whether we're ready to go to green on July 3rd. But certainly if the counties around us are not also careful, then they may see increased spread, and that may affect us. So I would certainly encourage the counties around us when they do reopen, whenever that is, to likewise promote our safe mode guidance or something like that.
Last question I have for you. You've mentioned Florida a couple of times and said, we don't want to go back and we don't want to be like Florida. Florida reopened, I think, in about mid-May while its numbers were still rising. It wouldn't seem that we're close to Florida now. We're well past their positioning when they reopened.
No, actually, if you look at Florida's graph, they reopened when their case rates were falling. Then their case rates stabilized, and now they're rising. So I think that they believed they were past the peak of this. They reopened too early and not carefully enough. And that's really an object lesson of what could happen if we do things wrong here.
Thank you.
Very good. Thank you, Jeff. Let's go now to Argenis Figueroa of Univision. Argenis, there you go.
Yep, okay.
You're up.
Okay, good afternoon, Mayor and everyone. I will need translation, please, Armando.
Por supuesto, Argenis. Buenas tardes.
Muchas gracias. Buenas tardes, Armando. Gracias. Bueno, quería pues preguntarle al doctor Farley, tengo dos preguntas, una de ellas para el doctor Farley, preguntarle si ya existe alguna guía para la reapertura de los salones de bellezas y barberías y dónde podrían buscarla los dueños de negocios.
I have two questions, and the first question is for Dr. Farley. Is there a guide already in place for the reopening of beauty salons and barbershops, and where can this guide be found?
No, we'll put that guide out next week. And it will be in English as well as Spanish.
Vamos a hacer disponible esta guía la próxima semana, tanto en inglés como en español, Argenis.
Ok, perfecto, gracias. Y la otra pregunta es para el alcalde y es relativo a la decisión de la Corte Suprema hoy sobre digamos, el mantener DACA activo y recibimos a través del departamento de prensa una comunicación que él emitió, pero si pudiera darle unas palabras a los hispanos en Filadelfia que están incluidos en este programa de DACA.
Bien. The second question is for the mayor, and this is in light of the decision of the Supreme Court to retain DACA as valid, as active. We have received your press release, but we would like to ask you to issue a statement for the Hispanic community that's affected or benefited by DACA here in Philadelphia, Mayor.
Well, first of all, I'm very happy that the court ruled the way it did. I think it's interesting when the speculation that a Supreme Court justice that's nominated by a conservative president like Donald Trump is expected by the president to carry his issues. And we can see that Justice Gorsuch is a person of integrity and of honor. And called the law as he saw was the right thing to do. And I think that gives us not only the 825,000 DACA recipients some breathing room and some peace of mind, but also gives the country some peace of mind that between Justice Roberts and Gorsuch and the like, the country will not be taken down the Donald Trump road without being pushed back by great justices like we have. So I'm very happy for the DACA recipients. I'm very excited and I'm a little bit overwhelmed by how Justice Gorsuch not only took the decision to write, but how he wrote it. And I think that bodes well for this country, the country's democratic existence going forward.
Quiero decir que primero, ante todo, me encuentro muy contento de que la Corte Suprema haya decidido de la manera como lo hizo. Y creo de que eso nos demuestra de que la tendencia de pensar de que la nominación de un juez de ideología conservadora para promover la agenda del presidente Donald Trump no tiene tanta importancia como los temas que sí la tienen. El hecho de que el juez Gorsuch haya tenido la integridad y el honor significa de que él interpretó la ley como lo vio correcto. Y eso nos llena de esperanza para los 825,000 residentes en este país que se benefician de DACA. Les da tranquilidad a ellos y también les da tranquilidad a nosotros como país y como nación, porque nos demuestra que entre la decisión del juez Gorsuch y el juez Roberts están haciendo lo correcto y no están tomando el camino que se esperaba que hicieran necesariamente indicando por el presidente Donald Trump. Significa de que están reaccionando ante ello como jueces que son, y yo me encuentro muy feliz y muy emocionado a nombre de los residentes en este país que se benefician de DACA. Y me parece muy notable, sin embargo, que el juez Gorsuch haya tomado la decisión que tomó y que haya sido él quien escribió la decisión y cómo la escribió. Eso nos augura cosas muy buenas en este país.
Muchas gracias, Armando. Esto.
Por nada, Argenis. Thank you very much.
Very good. Thank you, Argenis. Let's go now to Smith of CBS 3.
Hey, two COVID questions today. First for Dr. Farley. Dr. Farley, if you can talk a little bit more about the relationship between the state and the city's COVID-specific regulations, and does the cities supersede what the state allows?
The city will be more restricted than the state allows, and the city has the authority to do that for the reasons that I said just a couple of minutes ago, that we are uniquely at risk for a resurgence of this virus, and we don't want that to happen here.
All right, thank you very much. My second question is probably from Brian, also COVID related. Brian, we've heard that our police department tells us they've responded to at least or nearly 900 explosion calls since the COVID pandemic, maybe some from fireworks. Can you guys explain what, if anything, is being done about that?
So there has been a number of complaints and calls around explosions from fireworks or possibly something else. I think we are trying to figure out the best way to respond to that, but would remind everyone that fireworks in the city are illegal to light off, and care is needed as we move forward.
Brian, have there been any arrests or actions around that, officially, fines, summonses, or anything?
We'll have to get back to you with any data. I don't have that data here, though.
Okay, thank you.
Yep.
Are you good, Manny? Okay, let's, I just wanted to note that we have put in the chat the link to the Reopening with Care document, as well as a press release will be going out. We'll include that as well. Let's go now to Marcus Espinoza of Fox 29. Marcus, you're up. Are you able to unmute? All right. Hold off, Marcus. Let's go to Jack Tomzik of Metro. Jack, you're up.
Hi, hello?
Jack? Yep. Well, all right.
Sorry, guys. Am I able to chat real
Let's
quick?
get going here. I tell you what, let's go to Marcus. Go ahead.
Am I able to ask some questions? Sorry about
Yes,
that.
go ahead.
Okay. I was on the phone. Sorry about that. So my questions regarding the is it open to other questions now?
Yes, we are. Go ahead.
Okay. I wanted to ask about the budget proposal, Mayor, how you're receiving it. I know, during the COVID pandemic, you've been adamant on not getting rid of police and reduction numbers because it would be an issue. Is there and there's not a direct call to get rid of the number of police officers, but what is your assessment of the budget of that, the budget cut to the police department and the FOP's response, obviously disagreeing with it?
Well, first of all, we're obviously disappointed that at the beginning of this budget cycle, we have very ambitious plans to invest in education, job training, and other types of things that gave us our fund balances and our any day fund and our reserves gave us the ability to do. COVID came, we shut down, revenue shut off, and thank God we had all those extra revenues at hand, or we'd be twice as much in trouble as we've been. This budget process, the revised budget, and then even actually budget 3.0, it was a document that was always intended to be discussed and negotiated with the council, and we did that despite the pandemic and the civil unrest and the depression that we're in. I'm very proud of council and the mayor's office in working together and being mature and responsible adults and coming up with a budget that's workable. A lot of the things that people were asking for, other activities of the police department have been starting to move into other areas of the government, like the managing director's office or other departments within the city. And we will continue that process, and it's an evolutionary process. I think we're moving in that direction as a city, and as a country, in trying to get items that were traditionally 911 calls out of the hands of the police, because it's really not their training or responsibility to deal with people that are experiencing addiction or mental health illness, mental health issues, or homelessness. So we're trying to figure out ways of moving resources from the department into other departments that address those issues. I think in a short period of time, under great duress, I think we did a good job.
If this budget is passed, do you think it would create an unsafe environment regarding the police department and anything it might be affected there for how they currently operate versus what they'll have going forward?
You know, some of the initial increase proposed for the police budget had to do with body cameras and anti-racist training. So, you know, it wasn't all into buying equipment that was offensive in nature. It was trying to get the department to a place where every police officer had a body-worn camera, and the training was sufficient. But obviously, with the disruption of the last couple of weeks, training is not what people want. People want to see change, and they want to see officers doing different things, and other members of the government doing some of the things they used to do. There's no reason why a 911 call should be made to a person who's experiencing mental health issues to send people, you know, who are law enforcement. So we're trying to work our way with our department heads and city council to change the kind of emphasis that the police department has on the interaction with the public.
My final question regarding the body cameras, it was mentioned in this proposal they wanted to outfit everyone with body cameras. Is that possible with a cut in the budget?
Probably not, but we'll see. We'll do our best. We'll do our best we'll do our best to accomplish all the things everyone wants us to accomplish, despite the fact that we have $750 million less, are in a pandemic, and we're dealing with civil unrest that is righteous, but, you know, it's asking a lot in a short period of time.
Okay, thank you.
Thank you, Marcus. Let's go to Mike Donofrio of the Tribune.
Hi, can you hear me?
Yep, go ahead.
So just to be clear, so anyone from the administration, how will the reduced police funding affect the department? Because Commissioner Outlaw said the layoffs were most likely going to happen even if the budget remained flat. So are you anticipating layoffs in the department? How many, and what other programs and initiatives will be cut as a result of the funding drop?
Marissa or Rob?
So, hi, this is Marissa. So the question was, how is this going to be affected or impact the police department? And I think operationally, they're still trying to work through exactly what this means. But some of the things that this means is looking at, you know, typically there are a number of cadet classes to add each year. And what happens if we don't do that? We'll still see the attrition of folks leaving, retiring. And so that's some of the ways that this will be felt. And then they'll also be looking at overtime. Some of the areas that actually, as a result of the shutdown, we're seeing savings are in court overtime, as the courts have been shut down, as well as in the overtime for our large special events that typically would be happening at this time of year. So I think that operationally trying to still assess exactly what the impacts are, but we have some understanding about the different ways that this could be implemented and operationalized.
So do you expect the current level of police officers to decrease due to these fundings? The funding decrease?
So I would say that we're still figuring out operationally what that means, but certainly if we know we're going to continue to have retirements and folks leaving and we're not hiring up at the same pace, then that as a result would shrink the size of the force.
All right. And then the original, I guess the revised budget document from the administration in May said there would be cuts to anti-violence programs and gun violence programs to reduce gun violence, obviously. So does this new budget maintain those cuts? And specifically, how will they affect programs such as group violence intervention?
So within the budget, the May 1st version did streamline and in some areas pull back funding for anti-violence programs, but it did maintain programming or funding for evidence-based data driven programs like group violence intervention. And then there are some of the programs that haven't had as much success and haven't showed the same results. And so what those are being sort of scaled back and retooled so that we can make sure that they're really effective. There's also a couple of programs in there that are really based on sort of face-to-face in-person interaction, which obviously can't be happening right now with the social intervention. So the changes that were in place for the May 1st version of the budget remain in place in the version that council voted out of committee last night. And it still contains funding for anti-violence initiatives, but slightly different than what was initially introduced in March.
And then just the fund balance. I know last time, with everything changed, and the last time it was about 87 million. So what are you expecting now for fiscal year 21?
So we're probably going to have updated numbers in the next couple of days. Right now, we're 12 days out from the end of the fiscal year. So we really want to get these, use actual numbers as much as possible. But we have been projecting an $87 million fund balance for FY21 in the May 1st version. But unfortunately, on June 15th, we had to announce that some of the revenues were not coming in as well as that May 1st projection. And so that took us down again. But this budget that was passed out does have some changes around some debt restructuring that help get us back towards a positive fund balance. And also the reduction in funding for the police and fire budgets do enable some reinvestment elsewhere. So we think we're back positive, because obviously can only pass a balanced budget. And in the next, very shortly, what we're doing is monitoring exactly how things are shaking out for the end of this fiscal year, so we know what we'll have going into the fiscal year to come up with our most up-to-date fund balance numbers.
All right. I have more questions, but I'll, stop for now.
We'll come around to you again, Mike. Let's go now to Martin Pratt of YBN Philly.
Yes, this question is for Dr. Farley. Dr. Farley, I think you've went extensively into your feeling about frequent testing, but I would like for you to go a little deeper. And we're seeing around the country that places where there are frequent testing, it does seem like folks are being more cautious. And although we've done an excellent job, I think, of above and beyond for a lot of cities, a concern is that because we're going to be reopening and getting closer to green, that people will stop thinking about it. And it seems to be working in other cities where folks are definitely available to go get tested. They're being encouraged to go get tested frequently. Can you explain your position against being tested frequently?
Let me just say, we're having an explicit goal to increase the amount of testing we're doing in Philadelphia. So we're doing about 2,000 tests a day now. Our goal is to get that up to 5,000 tests a day. I don't think that our target population for that, though, is people who are healthy, testing them repeatedly. It's more people who have symptoms, who want to make it very easy for people who have symptoms to go in and get tested, and then people who have been exposed or think that they've been exposed. That's the important group for us to target. Again, 1.5 million people in the city of Philadelphia, to say everybody needs to be tested every 3 days will just never happen. But if we do expand our testing amongst that target population, we can have testing as an early trigger for increased viral spread. Let me just reiterate that testing is important. It's an important piece of the overall strategy, but testing by itself doesn't accomplish anything. It just tells you where the virus is. It doesn't stop it from spreading. It can provide information that can help you take actions to prevent viruses spreading, but you can also take those actions without that information. So testing isn't everything, and sometimes I think people think it is everything. So it's a piece of the strategy. We want to do more of it. I would not recommend it for people who are just have no symptoms and no reason to be concerned. But for people who are symptomatic or have been exposed, we strongly recommend it, and we want to make it as easy as possible.
In Europe, we're seeing a growth of the exposure apps, and I know that in China they've used these. What's your position? What's your thoughts on that coming stateside, and how successful or how well are these apps that tell you you're near someone possibly who's been exposed? Yeah,
so and that's what the app does is if other phones are turned on and yours are turned on, a person is diagnosed with the infection, then you can see who else has been in proximity to that person. It really depends on a lot of people turning that app on, and people may not want to do that here in Philadelphia. So we are building our infrastructure for contact tracing the old-fashioned way with people who talk to people, and we're going to explore whether those apps are useful here. I do not know whether they're going to be have enough people be willing to turn it on to make it useful. If they do, that's great. If not, we have the other techniques to fall back on.
Thank you. My last question is for Bryant. Is there a way, Bryant, that regular citizens can apply to be a part of the citizen review committee, board, whatever it's going to be called, for the police department?
So we're still working through exactly what that is. And so the proposal that council put forward is a charter change that then needs to be enacted by an ordinance of council. So I think we are just beginning that journey to really create strong citizen oversight.
Thank you.
Thank you, Martin. Now let's go to Laura McChrystal of the Inquirer.
Hi, I have a few questions on the budget. First, is there a clearer picture at this point yet as to how many layoffs of city employees there will need to be?
Brian?
Yes, Laura, I think we should be able to get that to you by the end of the day.
Okay, thank you. And a clarification on the impact of the police budget. The council had put out, in their announcement of the budget deal that there would still be enough money for body cameras and implicit bias training. The mayor had said that's kind of still being worked out. Can you clarify what's going on there?
Sure. So I think the intent is to still fund body-worn cameras. I think to clarify the mayor's statement is that we will not be able to complete the rollout to all the department with the funding that's available, but we will still be able to fund what was initially planned for in this fiscal year for body-worn cameras. The body-worn camera rollout has been a multi-year effort, and we're not quite through that yet. And some of that is a technology issue where we need to finish the renovations of the 2nd and 15th police districts, and part of that is just our ability to train officers on their use and make sure the equipment comes in. So both statements are correct. As we did retain funding for body-worn cameras for our police officers, but we're not going to be able to finish the complete rollout for this year.
Okay, that makes sense. And my last question is, with the announcement of the extra $100 million funding gap, and also that council put in sunsets after 1 year on the planned tax hikes. I know it's far out at this point, but anything you can say about where this might leave the city in the future? Like, do you have concerns that this budget dips too far into the fund balance or anything like that?
We have to put together our 5-year plan by the 29th for PICA. So as we go through that process, we'll make sure that we have fund balances that are healthy throughout those 5 years. But, that's definitely one of our concerns as we put that plan together.
Thank you.
Great. Thank you, Laura. Now let's go to Rudy Chinchilla of NBC 10.
Hi, guys. So I actually have one coronavirus question and one non-coronavirus question. The first one is, Martin sort of alluded to this as well earlier when he was saying some people, might be getting a little lax in terms of wearing masks and the such. One place we have seen that happen is in South Philly, which obviously has been a bit of a tinderbox for other reasons. But I did notice a lot of people there not wearing masks in a mass gathering. I'm wondering, is the city planning to do any sort of enforcement, when there are these large gatherings of people not wearing masks? Just given the fact that, Dr. Farley, you said as well, we've seen other states where they're not opening carefully and they've seen spikes. So yeah, I'm just wondering if the city has any plans to do some sort of enforcement when there's a lot of people and they're not wearing masks.
So what we're trying to do is establish so that wearing masks is the norm, something that everyone just does. But we're using the opportunities we have to do enforcement. So we'll be enforcing this on businesses so that they're enforcing it in turn on their customers. So at least when people are inside in a high-risk situation, they're using their masks. And then we're going to be doing media messages about mask wearing, promote it that way. It's pretty difficult to enforce it in an outside environment. We certainly are encouraging it. We'll do what we can, but we'll going to be this combination of promotion and then enforcement in places where we do have that ability.
Understood. And then the next question is actually for Mayor Kenney. Today, officials from around the state convened at City Hall to talk about banning chokeholds for police departments. They want to make it a statewide standard. Do you agree with this chokehold ban? Do you want to see it here in Philadelphia as well?
I believe, Brian, and Brian, correct me if I'm wrong, I believe we already have a chokehold ban in Philadelphia.
Yes.
And we do. And throughout the state, we shouldn't be chokeholding anybody in the country. And if state officials and legislative officials want to use City Hall as a backdrop for their effort, we're all together in this, and we have to fundamentally change the way we do things in order for us to move forward as a country equitably.
Thank you, gentlemen.
All right. Thank you, Rudy. And finally, let's go back to Mike Donofrio of the Tribune.
All right. If I could ask whoever's sending out the layoff update, if you could put me in on that as well, I'd appreciate that.
Yes. You are on my list.
So I heard that pre-kindergarten slots wouldn't be expanded this year and just be maintained at current levels. Is that still happening in this budget? And how many, slots were supposed to open, I guess, in September?
We have budgeted 3,300 slots.
Rob, your camera is off.
Okay. Yeah.
So seeing the new Rob.
Hi. So before in the March budget, we would have expanded from 3,300 to 4,300 slots, but we had to revise that because of the hit to our revenue to stay at 3,300 slots.
And then, looking, I guess if you could look in your crystal ball, if you could further revenue shortfalls happen, throughout the fiscal year due to the coronavirus, like I'm thinking, if a second wave hits the city and shutdown happens again, and kind of how would that impact city finances? How would the city respond? Are, any other taxes being considered to be raised at that time, et cetera?
So there are clearly risks because we're in kind of an unprecedented time, so we don't know exactly how this will play out over the next half a year or so. That's why it's really important that we maintain some fund balance, which we think we have, and as Marissa said, we'll have better numbers on that within the next couple of days. But yes, there continue to be risks.
All right, Mayor, do you want the final word?
No, I just wanted to remind people there is no crystal ball, as we would have seen all this coming. So all we can do is our best.
Can I ask one more question?
Well, if it's real quick, go ahead.
Real quick, big picture, I guess, for the mayor. How will the cuts throughout the budget affect your agenda to specifically, when you're looking to reduce poverty and gun violence in the city?
It reduces our agenda to a point that's we can afford to do it, and it will reduce in the short term the amount of poverty we can address and the education of our kids, and how we can attack poverty and violence in our neighborhoods. We have less resources. We're going to have less ability to address it. We did not take away all the ability to address it. We tried to maintain a balanced and realistic levels of service in those areas, and we'll continue to do that. And I can assure you that the time I have left in office, if the economy changes and we break out of COVID-19 and we get our justice and policing in an equitable situation, we'll continue to make progress. But I have no crystal ball.
All right.
Good. Thank you, Mike, and thank you, Mayor. Thanks again for everybody for joining today's daily briefing. We will be resuming these next Tuesday. Thanks again.